All right, I'm gonna show you guys how to do proper hand hygiene. Remember, you have to do soap and water hand hygiene whenever your hands are visibly soiled. Before and after patient contact, it's ideal to do it before any major like sterile procedure. And when there is certain microorganisms such as C. diff that we might interact with our and come into contact with our patient. So a lot of times hand sanitizer is sufficient, but in this case we're going to say that we need to wash our hands with soap and water. When doing that, you want to make sure that your clothing never touches the sink. I don't want my clothes to actually touch because that could be contaminated. I want to turn on the water, and you want it to be a nice warm temperature. Make sure you don't turn it so high that it's splashing on you. Then I'm going to go ahead and wash my hands once it's warm enough. And you're washing in a downward motion because that's causing all the microorganisms to rinse down. Okay. You're going to get soap. Now, whatever amount of soap comes out of the dispenser is the amount of soap you're supposed to use. That goes the same with hand sanitizer. A lot of times people will kind of put some on their hands and splash some off, but you want to use what that actually pumps out. So I want to make sure I'm washing every surface of my hands with some vigorous scrubbing, because you want to make sure that you get all those germs off. You want to make sure you go between each finger. You want to get underneath the nails. So you can use that by using your other fingernail here. Or some people do this. There are also like orange wood sticks or other sticks that you can use that are made to clean underneath nails. So you want to do this for however long the policy says. Usually it's about 20 to 30 seconds. And once you get that in your hands, you want to wash up your wrists. You want to go at least 2 inches above the soiled part, or at least 2 inches up on your wrist. Again, that kind of depends on your policy, so make sure you follow that. Now, I'm going to go ahead and rinse down. So here, I want to make sure that the water is draining from up to down, or the top of my arm down to my fingertips. I'm going to do the other arm. Make sure you don't cross over and rinse them at the same time as each other. Okay. Now when you're done, you want to reach over and get your first paper towel. With this, you want to start at the fingertips and go down. Then we're going to throw that in the trash. We're going to get another one. Start at those fingertips and go all the way down. Then you're going to get your last one, and you're going to use that to turn off your water. And then you'll throw that away. The reason that we turn off the water after we're done, and you use a new paper towel each time, you don't want to use a wet paper towel to retouch this surface, because wetness will actually transport bacteria. So if I had a wet paper towel and I used it to shut off the water, then the bacteria that was on these handles would then transfer back to my skin. So now your hands are properly washed. You also want to make sure, take off any jewelry or watches or anything that could hold microorganisms before you touch your patient. A wedding band only is recommended, and you just want to make sure you clean under it really well.